Good evening, all, and very warm welcome to all the doctors. And it's been a pleasure to meet you all, connect you all in yet another webinar. And of course, today we are going to speak on the webinar on practicing IVF the right way, and of course, the right way what we practice in Nova way as well. As you all know that ever since the first IVF baby born in 1978, IVF as a science is actually been the boon for lot of aspiring couples who face a challenge and need an assistance in their reproduction. But at the same time, practicing IVF also have to be brought or kind of consideration in terms of bringing in the utmost kind of an ethics and the transparency, which gives the kind of a trust to the patient in terms of believing in this procedure and trying to get an outcome the way that it has been expected or explained to them, and give that kind of an empowering that with the kind of a complete information which makes them to take the informed decision. And that is a whole idea today that we are here to discuss that practicing IVF the right way. And we have these stalwarts today who does not require kind of an introduction. And it's been indeed very honor and pleasure to welcome you, ma'am, Dr. Sonia Malik, our Chief Clinical Mentor in Nova IVF. And of course, Dr. Hitesh Bhatt, who been a very, very familiar face and does not require kind of an introduction to the August audience here, who's been the medical legal consult. And Dr. Sujata, who's been the head of our embryology here. So these experts and also with all the kind of the panelists we've been practicing in Nova IVF across the AP and Telangana. And today, of course, Dr. Sonia Malik is trying to take us through the journey with the kind of a discussions that the ways where we practice IVF the right way. And I welcome you, ma'am, to introduce the panelist and to start the program on this.
Thank you very much to all of you, and welcome to this very interesting webinar where we are once again taking you through the law and trying to tell you that, it is time that we have been, but we need to be much more transparent and very ethical in our practice because of the kind of scenario in the country. We know that the society at large is always suspicious. It's not just the doctors. We as a doctors are also suspicious of the intentions of other groups. For instance, the lawyers, the teachers, the mechanic who comes to our house for fixing the light. We are suspicious of each other. That is become our human nature. And so also happens with doctors. But this branch of science is so important because it is dealing with the life of human beings. So we need to rise above this and try and explain to our fellow beings that it's not true and that we are practicing everything very, very honest and fairly. So with this intent in mind and with what Mr. Selvam has already told you, ye batti on kar de. We have put together certain cases which you people come across every day and then are perplexed as to what we should be doing. The same happens to us at Nova also, but we have tried we have all together as a group evolved as a very ethical and transparent group because we keep discussing all this with each other. And without taking much time, I'm going to introduce my panelists to you, who are a group of doctors in this very region amongst you, and they are the ones who are, practicing this actually in their clinics. So therefore, let me first tell you Saroja Kapola, the last slide. Saroja Kapola at Kokatpalli, Hima Dipti at Banjara Hills, Swapna as at Vijayawada. These three girls are here as medical directors. Then you have Durga Vatyala, Divya Reddy and Anita as senior fertility consultants at Banjara Hills, LB Nagar and Warangal. And then we have another brilliant set of girls, the younger ones, Nikita PV, fertility consultant at Guntur, Divya Satya at Vizag, and Kirti Govindaram at AS Rao Nagar. So with all these brilliant youngsters, I'm here to discuss a couple of cases, and with the help of my colleagues from the embryology team and Dr. Hitesh Bhatt, we are going to take you through the various nuances of how to remain transparent and ethical and yet practice IVF in its best form. So let's take the first slide then. Should I share the screen now? I'll share my screen. 1 minute. Give me a minute. Just a second. Okay. So those of you who would not have seen our clinics or our centers, we know you all know probably that Nova is known for its standalone centers. And this is just a view of some of our clinics which we have across the country. And we all know that Nova has everything under one roof: counseling services, be it that or be it OT and IVF theater, laboratory, pre-op, post-op recovery beds, pathology, and even genetic labs, in-source drugstore. So it's a complete unit in all respects when we have to practice IVF. And then we come to the first question. And my first senior doctor is Dr. Sapna. So Sapna, here it is for you. You are faced with this couple. The female is 35 years of age and the male is 37 years. They presented with secondary infertility of 3 years. They have a 6-year-old child conceived spontaneously, and the couple has undergone multiple OI cycles without success. Given their age now, they are keen to pursue further treatment to conceive a second child as early as possible. So, however, the husband has expressed his hesitation towards further management because he is scared that the semen analysis twice before in different clinics showed different variation. So, therefore, this is a very common thing that you all come across, that reports are different and the patient doesn't know whom to believe. So, he is confused. Which one should he base his trust on? So, Swapna, how would you do that in Nova, your center? Can you just tell us?
Yeah, thank you very much, ma'am. And um, good evening, everyone. This is a very common scenario that we come across. So basically, it is understandable that the husband is confused, maybe the wife as well, because two different reports in two different clinics can pose a challenge to them. So first of all, I would like to reassure them that there is a way to solve this issue. And how I would do that is I would explain to them that there is a internationally recommended method, that is the WHO way recommended method to do the semen analysis. So we need to review whether his previous reports were done as per the WHO standards. However, in Nova, I can show them how we do it at Nova, which is what we are projecting in the slide at the moment. So we take care of each and every aspect of it. So apart from the method, the first step when they step into Nova is when they get registered, they get a unique ID with the husband and the wife having a very unique ID along with their Aadhaar cards. So we know, and a photographic picture of them when they registered. So that's the first step. And when we recommend the semen analysis to them to ensure whether the previous reports are correlating with the current one or not, we also ask them to give the semen analysis with right period of abstinence, which is as per the WHO recommendations. When they come to the center with the right period of abstinence and request for a semen analysis, we ensure that they get a label with all these ID details, and then they go to the andrology lab, where again an ID check is performed and also the abstinence period is checked, and they give the sample in the center, and the sample is analyzed immediately. The sample is analyzed immediately um,
And
to avoid any delay
hmm,
and right in front of them. When
hmm,
they give the container to collect the semen sample also, the container is labeled with all these ID details, and it's shown to the patient before they're given the container. And once the sample is collected also, they recheck it once again in their system along with the patient, and the analysis is done as per the SOP. There is a standard SOP in all the Nova centers to follow a particular method. Sorry, ma'am. There is a standard method that is followed in the all the Nova centers, and they follow this standardized method. And if there is any significant variation, we also get the senior andrology person and even an embryologist to relook at the report and recheck again to ensure that the report is given properly. And again, they come to the clinician, and we also recheck again to ensure whether all the steps have been followed, and we can reassure that this will be the most accurate method of performing, and this is a reliable report. However, I mean, the first semen analysis for any patient, if it's abnormal, as per the WHO guidelines, we always need to repeat it. So if we get a report which does not correlate with the outside report and the patient is still confused, we can always tell them that if the previous report was done as per the WHO standards, the one which is better is a good one. But if the previous reports were not done as per the WHO recommended method, then we can always say this is a properly done first sample. So we can always do a second one as per the WHO recommendation. So each and every step has to be meticulously followed. And also the ID check needs to be done properly. This is how we are going to go about and reassure the patient.
Absolutely.
And not worry about any confusion, so that we can recommend them the right treatment depending on that report.
And that registration remains in his forever, for till the time he is with us at Nova. We generally do not keep on changing the registration number so that there is no confusion over there, right? Right? Am I right?
Yes, ma'am. Yeah, absolutely.
Okay. So now we come to the second one, another perplexing thing. Mrs. X has low ovarian reserve and the husband, Mr. Y, has low count. They underwent 3 self cycles of ICSI, but no embryos were formed. Now the couple were considering to undergo IVF using donor gametes. They wish to know where the donors come from, how do we select a donor, and what is the age of the donor as recommended by the ART Act. So, Dr. Saroja, will you throw some light on this and what is our principle in Nova?
Thank you, ma'am, and good evening, everyone. In Nova, majority of our cycles are self cycles, but we do have some people, some couples who go for donor cycles. So we are very stringent and we follow the rules regularly. So all our donors, we get through the ART bank, whether it is a male donor or a female donor, all are routed through the ART bank, and that ART bank must be registered with the ART thing. And we then the next thing is, once we get a donor, we have to check about the age of the donor. For a female donor, the age should be between 23 to 35 years, and for a male donor, they can range from 21 to 55 years.
Yes.
And they can be known or unknown donor. And but however, they have to donate only once in a lifetime, and only for one donor for one couple is a norm. And we have to be very careful while selecting the age of the recipient also, because like we have many people like they cross 50. For a female age we shouldn't be taking them. For the recipient age it is 21 to 50 years for female, and for male it is 21 to 55 years. Then we have to get the affidavit is made, and it is signed by an notary or an executive magistrate, and we have to get an insurance right from the start of the stimulation, and it is for an year, to cover any complications arising from an OPU. And all the consent should be properly signed by both the donor as well as by the center, and it should be like the documentation is very vital nowadays, and it should be properly documented. And the semen, coming to the semen samples, we shouldn't collect the semen samples in our center. The screening of the donors, the selection of the donors, as well as storage of the semen samples should be done in the ART bank only. And we have to get the samples from the ART bank.
Okay, so these are very, very important things that we all must remember. And basically, the most important thing is to please see that the age of the donor, as indicated in the act, is different from the age of the recipient. And that is something that you have to be very careful about. Just a small question I will ask you. Now, it is very clearly written that she should either be married or a single woman over here. So how are you going to ensure that it is a married couple that is coming to you, maybe for self cycles? So Roja, how are you going to ensure that?
Ma'am, once it starts at the time of the registration only.
Yeah,
So we
absolutely.
ask them like to show the proper registered document like an Aadhaar card. In the Aadhaar card, if it mentions that Mrs. X, wife of so and so, and it is the same husband, then we can take it as that. If not, we'll ask them to provide a marriage certificate. So
Yeah.
so that we are only treating the married couples only.
Absolutely, absolutely. Thank you very much for that
Thank
input.
you very
Okay. So now, suppose we have to have a donor. That donor sperm also has to be taken from the bank, isn't it? And the bank has to also maintain the same kind of thing. I think I can ask Dr. Hitesh a bit about this. Dr. Hitesh, can you give your inputs on how to get, because the donor sperm is the donor for the sperm is never coming to the clinic. We have no idea about the donor. So how do we ensure that whatever we are getting is correct?
So
The paper, what is the paperwork essentially?
the most important thing is bank itself is an entity.
Mm,
Once bank is given a license, it is presumed that bank should give you a genuine sample. It is like if you purchase a drug from a registered pharmaceutical company and a
mm,
registered product, you don't
mm,
have to think whether this quantity of the drug which they are giving is proper or not, or the batch is proper or not, or chemical process is proper or not.
mm,
We
mm,
don't run laboratory. So
mm,
similarly, once the sample comes, you have to believe that it is the sample which is taken properly. But to
mm,
counter check, you have to have at least two, three things to establish that the sample has come from the bank.
mm, mm,
For that, you require a letter, forwarding letter from the bank that kindly accept this sample for your couple or
mm,
your infertile couple, which we are sending. That first
mm,
forwarding letter should be there that proves that the bank has sent you a sample and it is sample coming through the bank. You
mm,
must have the registration number and registration certificate of the bank from which you are getting the sample.
mm, mm.
Also,
Okay.
you have to ask for the reports of the semen,
Mm,
like semen report from the bank, the blood report from the bank of the
mm,
sample, and the profile of the donor, so that
mm,
couple also can choose that which sample or which donor they want.
mm.
So, if you are getting that many things with along with the sample, then you are good to go.
Okay. So now the very contentious question is basically, I will ask this from our embryology head of embryology training, Dr. Anuja Kamath. It says in the earlier guidelines, it was said that there should be an there should be a quarantine period of 6 months in the semen for the semen sample. Are we still maintaining that? Should we do it or should we not do it? Because it's not mentioned in the current act. And that is
Again,
something that some people want to know very, very actively. They want to know whether we are maintaining that or not.
there are two or three aspects here we have to understand. The first thing is law cannot teach you complete medicine.
Uh,
Law will give you just a guideline. If
mhm,
your medical science proves that by quarantining a sample you are reducing significant number of HIV transmission, you must do
mm.
it.
Okay.
And it is bank who has to do it. First
Okay.
thing.
Okay.
Second thing, to even if person is HIV positive,
Mm.
actually IVF is the process where it will
We're trying to
decrease the
eliminate.
chances of
Eliminate.
transmitting HIV. So
Yes,
it
yes.
is rather a treatment. And
Mm,
third thing, on a safer side, we always take a consent
mm,
that this sample is not quarantined. We are giving that information to the patient as well. So
mm,
we need not worry because we know that there is a window period always, and
mm.
whatever you do, there is always a possibility of having that disease if at all it has to come.
Hmm. So basically, what you are telling us is that yes, we should, if we can do it, it's very good. If we don't do it, we can explain it well to the patient that this is how we look at it and that is why it has not been done. Is that so? Am I right
Yes,
over there?
because
Yes?
because you have to catch hold of that donor
Yeah.
again after 6 months to get his sample. You have to get HIV testing done, and if
Uh,
it is negative, then only you can release the. What if
correct.
after giving sample at bank he has shifted to America? Who will come back here to get HIV tested?
So please, viewers, note these are very practical things which you must always think and consider when you are talking to an ART specialist. As to some of these are compulsions and some of these are relative, things that have been indicated by the Act. Is my screen visible? I don't know what has happened to me.
It is all the slides are seen. You have to put it to
Okay,
the
put it on
one
slideshow. Yeah.
slide. Yeah.
Okay, okay, all right. ठीक है, slideshow कर दी. कहाँ गया? Okay, पर ये तो हो चुका है. Something went wrong. I don't know what happened.
Now it
So,
is okay.
Yeah, Hima, this is for you now. A
Yes,
very important aspect in a fertility center is to prevent gamete, sperms, eggs, embryo mix-up. This is something which bothers each of us, that something wrong may not happen. What are the measures that we are following to prevent gamete mix-up at a premium unit or like Nova IVF? What are we doing special?
so good evening, everybody. Thank you, Sonia ma'am, for this question. This is so relevant in the current scenario.
Yeah.
And I think this is the worst fear that anybody can have when stepping into a fertility unit, be it the patient who's stepping into unit or as a fertility consultant. I would also not like to have any mix-up of gametes in the lab. And Nova being what it is, we follow the right way. We have protocols in place to prevent this from happening. And I want to reiterate to the audience that we have a two-tier system, a two-step system, because we are very, very sincere and we want to stick on to this policy where there is no chance of any mix-up of gametes. So the first thing I want to speak about is electronic witness system. Now, this is a technology. So we're taking technology into hand and we give RFID cards, radio frequency identification cards, which have barcodes in them on them. So from the moment
Show
a
the video.
gamete,
Do you want me to show the video, Hima? Should I?
probably after
Yes.
this, ma'am.
Oh, okay. All right. Carry on, please.
So once we issue this RFID card, this has barcode on them. And the very sophisticated lab that we speak about, all the equipments are fitted with RFID readers with their connected software. So what actually happens in the Nova units is whenever a gamete is handled, be it the eggs, sperms, embryos, immediately this is being recorded onto the RFID system. So the patient's name, the patient's ID, the husband's name, the husband's ID. Who is the embryologist who's handling them? Everything is getting recorded, noted. And the best part being, this is being done in real time, automatically. So there is no scope for any human error. So once the human error comes down to minimum, we can assure our patients and our doctors that the chance of mix-up is very, very minimum, or literally it's not there. Now, having said that, we also have a beautiful alarm system in place. Now, what does this alarm system do? By chance, if we are handling another patient's gametes, immediately it sends out a strong buzzing sound in the lab. So the embryologist is immediately alerted that these embryos are not of this patient. So you can actually prevent a mishap from happening. So this is the beauty of the electronic witness system that we have in the lab. I think just as we have the military or the police who are, protecting us day and night, and we are able to sleep peacefully, I would like to call this very sophisticated electronic witness system as a digital guardian for our patients' eggs, sperms, and embryos.
Yes,
And
absolutely.
to top it, madam, we also have a double witnessing system that we follow.
Correct.
Now, what is this double witnessing system? Every time a patient's gametes are handled, there are two embryologists who are confirming the name of the patient, the ID of the patient, the name of the husband, the ID of the husband, and only then these gametes are handled. So, first, the embryologists are confirming the gametes, and then to top it off, we have the digital system again rechecking it. I think with this two-tier system in place, we are completely sticking on to our Nova's way, the right way of doing things and maintaining transparency and trust with our patients.
Yes. So I think we've taken adequate steps right from the time the patient steps into the clinic, as we go on to do these various procedures, we are tracking them at each level and doing whatever is possible at this moment through science to see that nothing happens. So I shall
Yes, ma'am.
basically start
Probably.
this video to basically let you know what Hima has been telling you, and she's going to let us know what is happening here.
So this is a checklist which we have. So even before we start off, every patient, a checklist is followed. This is the RFID fitted system. This is the RFID card that is given to the patient. And this is the RFID reader, which reads the card. And this is practically there in every Nova IVF lab. And this is the working station. So immediately when the gametes are placed on the working station, the software that is connected there, the screen, that immediately notes down, it shows us the ID of the patient. So now this is a small video recording which is showing in real time how everything gets recorded. And if the gametes are not matching with the patient, the alarm system starts off. So we have blurred the patient's IDs, but it shows very clearly the name of the patient, the ID of the patient, the name of the husband, the ID of the husband, the embryologist, the time at which these gametes are being handled. So, and if they do not match, it immediately gives off an alarm. So that's
Thank
how
you.
simple and efficient it is.
Thank you, Hima. I would like to ask Dr. Anuja. She is our head of training at the institute where we are training our embryologists, and I would like to ask her, when you have these young embryologists being trained under you in Bangalore, are you actually introducing them to these witness systems and making them aware of the fact that there should be nothing like mixing happening in any of the clinics? Are you very particular about this? Dr. Anuja, please. Hello? Hello? Can you hear me?
Yes, I can.
Uh,
Am I
can
not audible?
Yeah, make it a little louder, please.
Yeah. Am I audible now, ma'am?
Yes, better.
So, yes, we take it very seriously. And just to, tell you that NOAA has a dedicated lot of embryologists who work very ethically right from the beginning. When they step into NOAA, they spend 6 months in the academy getting trained in all the NOAA SOPs. And we make sure that, right from day one, we tell them about this witnessing system. We have a full-fledged lab mimicking actual lab in the academy, so that they are used to all the systems that are in the NOAA laboratory. And right from day one, we train them how to use the witnessing system, how to follow the SOPs, how to be ethical. So, going forward, I would just like to, highlight few points why, it is very, very safe getting a, IVF case done in NOAA. So we all know that, at certain point of time, there might be patients coming into the clinic, two different patients with same name. For example, there can be many Kavitas walking in. So we do have, multiple identifiers. For example, we label our dishes or our labware and other consumables and disposables that we use for that patient with the full name of the patient along with the husband's name. Plus, we label the MR, the medical record number. We put the date. So, we do not only leave it to a single identifier. So, we have multiple identifiers which go on to the consumables and disposables so that there is no chance of mix-up happening. Then, as Dr. Swapna mentioned earlier, we do check the identification of the husband as well as the wife before we start with any procedure. I mean, before even giving the collection container to the husband, we do check the identity card. Similarly, before taking in the patient for ovum pickup, we do check the ID card of the wife. Then, as Dr. Himadipti mentioned, we have this electronic witnessing system where all the consumables used for that patient, they have this RFID tag. Then another thing is, we use waterproof, smudge-proof labels. Okay, so there is no chance of the labeling, not visible, or chances of the label getting erased or peeling off. So no chance of that. So we use waterproof, smudge-proof labels. And always each and every procedure is cross-checked by at least two embryologists. along with the electronic witnessing system, we have the documented witnessing system also, which has to be signed by two people uh, at any of the procedures. I mean, ovum pickup, denudation, IVF, ICSI, cryopreservation, embryo transfer. So two embryologists have to sign that document at every step. Then another thing is we do not handle more than one patient's gamete or embryo at any point, at any given point of time. So, I mean, at one point of time, only one patient's gametes or embryos are taken out from the incubator and are at the workstation. So, at no point of time, two patients, gametes or embryos will be outside. Then we have multiple incubators, and we, I mean, always dedicate one chamber of one incubator for one patient. So there is exclusivity of embryo culture. Many a times what happens is due to lack of space, multiple patients' dishes would be kept in a single chamber or on a single shelf. But we do not do that. We make sure that we have ample number of incubators to handle the caseload. And we use one chamber. I mean, for example, in a benchtop incubator, you have two chambers. So we use one chamber exclusively for one patient. So we do not put any other patient's dish in that chamber.
Okay, so I think
Also,
that is a lot of effort that you all are doing. I
yes,
think with this kind of a very, very stringent criteria, I don't think there is any chance of anything being mixed with any other thing.
yes,
So the
absolutely.
patient should be absolutely sure, as well as our doctors who are with us today in this webinar, that we are taking undue, I would say, precautions to prevent this thing from happening. But yes, it is something like a calamity if it does happen, so it should not happen. So we move on now to the next question. And for that, I would, well, it's not, oh, अब ये पूरी चलेगी. Oh, now, yeah, okay. So now, Mrs. A, 40 years old, complaining of DOR with an AMH of 0.1, and Mr. B, 42 years, with azoospermia, visit our center and want IVF with donor eggs and husband sperms. Both are overseas citizens of India, card holders. And then what is the protocol for such a case? Would it be different in case both the passports are from another country? And can such couples, OCI and other country citizens, opt for surrogacy in India also? So this is a question that maybe, who can answer. 1 minute. This is, yeah. So basically, I don't know whose question was, who had
Ma'am,
given.
I'll take the
You
question.
take it. Yeah, you take it, please.
Yeah.
I think you gave me this question.
Yeah.
Please introduce yourself once.
I'm Dr. Divya Sahitya Nambala. I'm the fertility consultant Visakhapatnam, Nova IVF Fertility.
Okay.
Thank you, ma'am, for this opportunity. So with regards to the question, ma'am, with regards to overseas citizens of India or non-resident Indians, the ART rules stay the same, ma'am, with the same as the Indian citizens. With regard to the donor, both donor oocyte or oocyte donation or donor sperms must be routed through the government licensed ART banks, and insurance of the donor is must. All the donor requirements and documentation have already been covered. So coming to the foreign passport holders or, the couples who are not the citizens of India, yes, foreigners can avail IVF treatment in India. I mean, if they subject to the fulfillment of the eligibility criteria under the ART Act, ma'am, they must be on a medical visa. And no ART procedure can be carried out on a tourist visa.
Yes.
Without a medical visa, international patients are limited only to OP consultations.
Okay. So basically, sorry.
Yeah, I would like to
Dr.
add that,
Hitesh, I was coming to you.
yeah,
Yes.
OCI card holders do not require any medical visa to take treatment in India. OCI card holders are having a OCI card, and that not only includes the flawless entry into the country, but they also are allowed to have a medical treatment in their
Yes, sir.
country of origin.
Yes, sir.
And as far as NRIs are concerned, NRIs basically they have passport, Indian passport, right? They are not staying in country for more than 6 months. That is why they are called NRI. They are basically non-resident Indian. So they are basically Indian. Their passport is Indian, and any Indian passport holder, whether he lives in the country or he leaves the country, he is entitled to get all the benefits which country gives to the citizen.
Mm. So therefore, very clear, very thank you, Dr. Hitesh, for this, for your comments. This was very important. It's a confusing thing when it comes to international patients, because we are all confused. NRIs and OCIs card holders are essentially Indian, and therefore they do not require any special
Right.
thing.
OCI card holder is not Indian. OCI
Yes,
is
yes,
overseas
yes.
citizen of India card. That means they are holding passport of some other country, but
But
they are given a OCI card.
so basically, they do not require a medical visa. That
They
is
do
what.
not require medical visa.
Okay. So therefore, we have to be very clear on that. And of course, foreign passport holders are not
They-
allowed to do surrogacy in India, right, Dr. Hitesh?
yes, yes.
Surrogacy.
For foreigners, they have to have medical visa.
Mm-hmm.
And for any indoor procedure. That means for ovum pickup, they require for consultation or for giving sample, they don't require any medical visa. But when it comes to any
Procedures.
indoor thing, then you require the medical visa.
Correct. So then, Dr. Anita, can an unregistered, coming to a different topic now, an unregistered ART level 1 referring gynecologist and registered ART level 1 clinic referral gynecologist, they both do controlled ovarian stimulation for IUI and IVF and then refer them to IVF centers to perform the procedure. Now, what is Nova's policy and what are the ART Act recommendations on this thing? One is a level 1, she's referring a gynecologist, and the second one has a clinic also, which is level 1, and they also refer. So what is the difference and what are they supposed to be doing?
Good evening, ma'am. This is Dr. Anita, ma'am, from Warangal Nova IVF Center.
Yes.
Thank you for the opportunity, ma'am. First of all, I would like to take this as a 3 questions, ma'am. One is unregistered gynecologist, which is unregistered ART level 1 center. When they refer the patients, so they can refer the patients to the level 2. But the thing here is they can stimulate only ovulation induction to the patients for the time intercourse. They are not legally allowed to do a controlled ovarian stimulation according to the ART Act. Number 2 is ART level 1 referral gynecologist. He is legally permitted to do a controlled ovarian stimulation for IUI. When it comes to the IVF, first the patient has to be registered at level 2 center and they have to get thorough evaluation, and once examined by level 2 clinic doctor, a protocol will be decided and it will be shared with the referral doctor.
Correct, absolutely.
Then they can do a stimulation over there at level 1 center and can be referred back to the level 2 center for the procedure to be carried out, where the thorough documentation and the consents and the reporting will be done at the level 2 center.
Absolutely. Dr. Hitesh, would you like to add something to this? And then I move on to the notification that came.
Sure. First thing is there is nothing like unregistered level 1. When it is unregistered for anything. Now, there is a concept, a gynecologist can treat the patient, gynecologist can give injection to the patient. It need not require any registration apart from medical council registration to give injections to the patient.
Correct.
The only concern here is when the patient is stimulated for ovum pickup, there are certain forms to be filled. Those forms always pertain to level 2 clinic. And those forms have to be filled. Once those forms are filled, that is form number 6, form number 12, once those forms are filled, patient can be stimulated anywhere. Patient herself can take injection if she knows how to give injection. So there is nothing like license for stimulating a patient. There is no such license. Only license is your medical council registration. If you have registration, you can give any injection. So it's a misconception that there is some level, and there is nothing like which dose is for ovarian induction and which dose is for stimulation. That depends upon patient to patient. It is not that up to 75 is this and to 200 is for this. There is nothing like that. There is no clear such boundary in that. Right. Only thing is patient should not be overstimulated in either case. So we are confusing law with the medicine. Law will never teach you medicine. Law cannot put a boundary that up to this dose. Even in level 2, you require less dose, and in level 1 you require more dose, which may be sufficient for somebody for home pickup, which may be sufficient enough for IUI in some other case. So there is no such boundary.
Okay. So therefore, now I come to this notification that has just come on 25th August 2025. Now, according to this, therefore, the query is ART level 1 clinics are registered only for performing IUI procedures, but it has been observed that most of the ART level 1 clinics are also performing ovarian stimulation processes, and these are basically for IVF. So your kind attention is drawn to 13 rules C in the ART Regulation Act of 22 and so, which states the clinic shall ensure the controlled ovarian stimulation of women in order to prevent ovarian hyperstimulation, exactly what Dr. Hitesh has said. Accordingly, it is clarified that the procedure of controlled ovarian stimulation can be undertaken by level 1 clinics, level 2 ART clinics, and surrogacy clinics, subject to compliance of the provisions of the ART Act 2021 and surrogacy. It is further suggested that as a good practice, in case of untoward incidents, the clinic should be equipped with emergency care pathway for ovarian hyperstimulation or related complications. So therefore, now this RTI is clearly indicating what doctor is telling us, that if you are capable of stimulating, you can stimulate. But basically, what the earlier law was stating was there was a clear demarcation between. That was also not in the act, but it was in an RTI which was sent in order to clarify the same situation. And there the answer was that level 1 is actually meant for IUI, so only for that, and level 2 is meant for IVF, so only for that. However, it is much better clarified over here. And so we need to follow this latest guideline now, which is there, and which Dr. Hitesh is also telling us. Yes.
The most important thing here is filling the forms. That is under the law.
Yes.
And the second thing is RTIs, any RTI which is filed or any such notifications which doesn't actually hold any water, because these are not legal things. They are just putting some notification. Like in Karnataka, they have put notification that you cannot allow any relative inside the sonography room. Now that kind of things are actually against the law. They cannot put anything which is not there in the law. So we just have to follow what is there in the law. You have to fill the form. That is most important thing.
And is there, so just to clarify for our level 1 and level 2 clinicians over here, is there any difference in the forms for level 1 and for level 2, Dr. Hitesh?
Yes, certainly. For level 1, the form is number 7 and 8. That is for IUI with husband semen, IUI with donor semen. That is pertaining to level 1. While level 2 will have all other forms. So form number 6, 7, 8, 9, 10, 11, 12, all these forms pertain to level 2 clinics.
So then now my question is, can a level 1 clinician fill up the level 2 form?
No. So that is why what we are suggesting, that is why what we are suggesting is whenever patient comes to the level 1 clinic for home pickup needs, they have to be sent to level 2 clinic where the forms have to be filled, and maybe prescription also can be given from them because they are going to do pickup. So whatever they are okay with, that drug should be given to this patient. And then the patient can come back, get stimulation done at level 1 or wherever they want to get. And then again, they can go back for the ovum pickup.
So excellently explained. I think now everything is very clear. It is basically the forms which make you level 1 and level 2. They differentiate you, and therefore you have to do that and accordingly stimulate the patient. We'll go on to the next one, therefore. So therefore, now this question is also interesting. A couple of Indian origin, wife of 28 years old and husband 34-year-old, diagnosed with MRKH, that is Mullerian agenesis, was advised for surrogacy. And also ovarian reserve was poor. Her AMH was only 0.01 and husband had non-azoospermia. Now, can we source the oocytes from donor for surrogacy? Can a woman act as a surrogate mother by providing her own gametes? And what is the eligibility criteria for a woman to act as a surrogate? Nikita, can you take that one, please?
Good evening, ma'am. Thank you for the opportunity. So before proceeding further for the answering the questions, ma'am, I would like to verify the couple in this case are legally eligible for availing surrogacy in India or not. So here, as we know that indenting couple for availing surrogacy should be of Indian origin with a female age between 23 to 35 years and male age between 26 to 55 years of age, and there should be a clear cut indication for surrogacy, like it should be the certification of medical indication should be given by the district medical board, and then and they should not be having any surviving child biologically, either through adoption or through a surrogacy. For example, if a child is having serious medical or psychological disability, or a child is having lethal disease where the cure is not permanent, in that case, they are eligible for availing surrogacy for a second child. So, in that sense, in this context, we have a couple here, 28-year and 34-year-old. So, with a clear indication for surrogacy, they are having a Mullerian agency. So, it's a complete absence of uterus. So, they can go ahead for availing surrogacy. And the question also mentions that her ovarian reserve was very poor here. So AMH is around 0.1 only, and husband is normozoospermic. So can we source the donor gametes is the question. So as per the law, the intending couple must have the gametes, both the gametes from the intending couple only. But however, in such situations, in some cases, if a district medical board certifies if the whether a husband or a wife having some medical condition which necessitates them to have a donor gametes, then in such cases we can go ahead sourcing the oocytes from the donors or sperms from the husband, providing at least one gamete should be from the indenting couple. So the question to the answer to the question one is definitely yes, if a district medical board certifies it. And the second question mentions whether the surrogate mother, at least, surrogate mother can donate the gametes. The answer would be absolutely no, ma'am, because the law mentions that surrogate mother should not be genetically related to the child born through the surrogacy. So in such cases, we can't source the oocytes from the surrogate mother. She should act only as a surrogate. So, and eligibility regarding the eligibility criteria for surrogate mother, ma'am, she should be a ever married woman, age between 25 to 35 years old, and she should have her child of her own, and she should be willing for altruistic surrogacy. In such cases, we can go ahead with the certificate of essentiality provided by the appropriate authority. So, in such cases, we can go ahead for surrogacy.
So very, very important things you have laid out and you have said very clearly. Number one, the most important thing is surrogacy is altruistic in India. Number two, there are specific age limits for these couples, for the male as well as the female. And of course, the surrogate has to be of a particular age, and therefore she also has to have a child. So all those things, and of course, the essentiality certificate and eligibility certificate and all those things, and then they can actually go ahead for surrogacy. This amendment in the rules in 2024 actually allowed the use of egg donors or sperm donors for surrogacy also. But as Nikita has very, very nicely mentioned, that it is only with the permission of the magistrate that you can get it done. Otherwise, it is still not permitted as such for everybody. So then we come to Divya. So Divya, if a patient has frozen their gametes for a long time, say 10 years, what safety protocols are you following to avoid cross-contamination in liquid nitrogen tanks and ensure viability? What are you going to ask your embryologist?
Good evening, madam. Thank you for the question. The biosafety and viability of the gametes and embryos is very, very important. We every day liquid nitrogen levels are checked, the temperature is checked, and we freeze our embryos and gametes in jumbo tanks, which has around each tank has about 11 canisters, and each canister has 2 goblets, and these goblets are totally sealed, and each goblet can hold up to 11 visotubes which are color coded, and each visotube again can hold up to around 10 cryologs. Each cryolog can hold up to 2 embryos or up to 3 oocytes, and every day the levels are checked and temperature is made sure it is about minus 196 degrees, and we refill the liquid nitrogen tanks once in 2 days to avoid any formation of residue due to vaporization. And entire liquid nitrogen is changed in 2 to 3 years. And whenever we do that, we use only sterile and filtered liquid nitrogen to avoid any cross contamination. Also, the seropositive gametes and embryos are stored separately. And whereas when it comes to semen, semen is stored in sealed vials and in cryocanes. Each cryocane can hold up to 5 sealed vials. So this is how we store our embryos and gametes and make sure the cross contamination does not happen and the viability is maintained. I would request our expert embryologist, Dr. Anuja, to give her inputs on lab conditions and embryologists' precautions which they take further.
Dr. Anuja.
Yes, Dr. Divya. So whatever you mentioned,
Make
it's
your voice is again not audible. Make your volume
now
higher. Make your volume highest.
is it okay?
Come closer to the mic then. Come
Yeah,
closer.
I mean, I'm
Acha, all
very
right,
close
all
to
right.
the mic.
Okay, all right.
So
Yes,
whatever
we can
Dr.
hear you.
Divya mentioned, yes, I mean, we do all this. Apart from that, there is a regular AMC, that is, we do a maintenance check of integrity of the cans, which is very important. You know, you have to check the lids, the neck seals, the vacuum layers, and this comes as a part of the preventive maintenance, because if the liquid nitrogen can develops any kind of problem, then the gametes stored inside can be at a risk. So, as a preventive measure, this also is checked. We also have disaster management SOPs, particularly for conditions like fire, flood, tank failure, which are beyond anyone's control. So, in those cases, what is to be exactly done? So, there are SOPs laid down for this. So, and all the embryologists are aware of that. So in such situation, what is to be done so that we can, not compromise the viability of the stored gametes and the embryos.
Okay, great. So essentially, this is how we are ensuring very much. And I'll ask you a pertinent question. What were the instructions that you gave them during COVID when it was very difficult to get liquid nitrogen also? What did you ensure somehow that all our canisters were well filled and there was no calamity happening anywhere?
Yes. It was always, we always had a spare can with
Yes.
liquid nitrogen stored in that. And then an embryologist would always, once in 2 days, go and check the levels of liquid nitrogen
There you are.
and make sure that the liquid nitrogen in the can was topped up. So these measures were also taken care of during COVID. So, yeah.
So essentially, you can see now, I would say again to the viewers, you can see how much of intense work goes on to produce these embryos and to see that they are fruitfully planted into you to get a pregnancy. So in order to get a wonderful outcome out of every single embryo, there is a lot of labor that goes in by the clinicians and the embryologists and the whole team, I would say. And therefore, it is important that you must keep on having confidence in a team where you are entrusting your patient, So basically, all of us here in Nova are very, 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 very fiercely, I would say, ethical and transparent. So coming now then to Dr. Durga, a 17-year-old has frozen his semen at your clinic prior to the start of chemotherapy for cancer as a part of fertility preservation. He did not survive the cancer. Now the parents want to use the sperm for pregnancy. What is the legal position on this? Now we are talking about posthumous reproduction. What is the legal position?
Good evening, ma'am. Yes, ma'am. So we are here talking about the posthumous reproduction, that is usage of sperms after the patient's death. So this can be done in two situations. One is already cryopreserved sperms can be used, and the other one is where surgical sperm retrieval is done within 24 hours of the death of the patient. So here, though the law says there is no such prohibition under the Indian law on the posthumous reproduction. In fact, there was one case in Delhi last year where the Delhi High Court approved the parents of the deceased patient and they were given the access to use these sperms. However, ART bill do not explicitly cover the posthumous reproduction, and the cases usually depend on the court's approval or the consent forms. So, but as a clinicians, we have to keep certain things in mind, like the consent form is one of the most important thing. The patient should have given the consent form before the death, and according to the form 11 under the ART bill, and based on that, if there is no consent sign, yes, definitely posthumously reproduction cannot be done. And if there is a consent form, again, whether the authorization was given to whom, that based on that, again, situation is different. So if the patient is married and he has a wife, there's no problem, because she can use, if the consent is in place, she can use the sperms either through an IUI or an IVF. But again, there are series of questions that are arised if the patient is a minor or unmarried. So here the main question is how these sperms are used by the parents of the deceased. First, number one question. And number two is whether they are used as with the donor oocytes along with the surrogacy. And again, surrogacy law states that one of the gametes should be there from the commissioning couple. And the next question is, who is going to be the commissioning couple? Whether the parents of the deceased is going to be the parents or the grandparents. There's so many such questions where ART bill has not given any conclusion. So I think Dr. Hitesh Bhatt sir can give a better insight on this.
Yes, Dr. Hitesh, your final word.
No, she has rightly said that there is no way you can use it. Whatever Delhi court has said or any court has said is at the discretion of the court for that particular case. And that too, they have asked them to keep the sample or take the sample, but where to use, they also don't know.
Correct.
So the aim of the law is, because where will you use it? That is the main thing. Where will you use it? If couple takes it, like parents take it, they cannot, the mother cannot conceive with the child's semen, right? That is an insist, which law never envisaged to do that in India. And if it is given to sister, then also it is of no use. It is consanguinity we are creating.
Correct.
So, if he is not married, anybody can't be made pregnant with that semen. So these are all questions which is at the discretion of the court. Only thing is the right on that property is of the couple or of the person whose name is written. So that person will have a rightful possession, but they can't do it. Like recently, India has got the Buddha's dent, the denture or the tooth back from somewhere. So that is it. You can't use it. You can't fix it in your mouth, or you can't do anything. You just worship it. That's it. That is the only purpose at present.
Maybe they'll make stem cells out of it and put it in somebody.
Yeah, whatever. But at present, even for research,
by then I think expiry of the cryopreservation will be finished.
They have said that the material frozen cannot be used for research purpose. The purpose here was fertility preservation, not the research.
Exactly. So I think we are very clear. Posthumous reproduction is still a query, but yes, there is a beginning. We can give it to the wife if it is already written over there. Kirti, a couple with female age 24 and male 33, married 3 years, got evaluated and is found to be having azoospermia. How do you proceed now? The couple is keen on self-gametes.
Good evening, ma'am, and thank you so much for this question. So coming to azoospermia, ma'am, it is a very frustrating diagnosis to the couple, and that leads to a lot of mental agony, and they're quite confused as to what to be the next. So the first and foremost things comes up is to repeat the semen analysis to reconfirm the diagnosis, as we were discussing it prior. How important is it to analyze it from a standardized lab? So I had a case, ma'am, recently wherein a couple walked to me with the azoospermia report from 2 different labs. So I asked for a repeat analysis, and surprisingly, we were able to see the sperms in the ejaculate, and it was a severe oats with a count of 0.1 million. So I immediately asked for a semen freezing of 2 samples, and with a fresh sample on the day of pickup. So with these 3 samples, we were able to form 5 beautiful blastoses. So this emphasizes the importance of reconfirming the diagnosis. Once the diagnosis is confirmed, if it's an azoospermia, then we need to do a step-by-step evaluation to differentiate between an obstructive or a non-obstructive azoospermia by thorough physical examination, history taking, and evaluation with the hormonal profile and all. And based on that, we can advise them for testicular sperm aspiration or a micro TZ. And if the couple is keen, if the couple is okay in the donor, then the simple procedure would be an IUI with the donor's semen. Provided the female parameters are normal, the ovarian reserve is good.
Absolutely. So essentially, yes, if the patient wants his own sperms, we still have many methods to help them. And we are all very well equipped in all the Nova centers to perform TC and micro TC, and our results are also very good for that. But definitely, we have to proceed stepwise, and we can't keep on giving it to everybody. We can't keep on telling anybody with azoospermia that we will do a micro TC. That is not the right way. We have to assess and then actually. So now we come to the most important person and the most important part of this webinar, and that is consents and compliance that we carry out at Nova and the audits that we have over here. So we have with us Nidhi Raj Verma. She is head of the compliance team, and you can understand with so many centers, more than 120 centers across the country, Nidhi Raj is actually looking after all this, and she will give us, she will now give us an insight into what exactly is happening. Nidhi Raj, please.
Thank you, ma'am. Thanks for the nice intro, and thanks for giving me this opportunity to talk about on this platform. So basically, we are talking about the right way of practicing IVF, right? So if we are practicing, right thing, then we need to have the right document also in place. That means the consents. So just to make it more prominent and more appropriately used by the user, because we have user at the center level who is customer care executive, starting from customer care executive to the consultant. So all these people are using these consents, and basically in healthcare system, the consent taking is a very, very and vital role for all of us, because whatever we are doing, if we are not documenting it well, that means we are not doing. This is what is perceived and presumed. So it plays a very vital and important role per se in terms of documenting the things in a right way, right? And as far as the ART is concerned, we have a level up in terms of maintaining the documents, right? So when we talk or just yes, ma'am.
No, I thought
just
sorry.
No. So just to mitigate or just to nullify the error, right? What we have done at NOAA, we have created the consent booklet with the name of type of treatment, so that the people, the person, the team who is choosing the booklet, they will choose the right set of booklet. And it is a booklet, it is not a loose paper. So we have a complete set of consent in a one booklet for
to make mistakes like this.
Yeah, you are not expected to make the mistake. The first step to choose the right set of consent, which we have somehow nullified by preparing the consent booklet in a treatment wise format. So I have placed few booklet like how we have made, so that we can actually nullify those errors and we can neutralize those errors. So that is from the consent perspective. And when we talk about compliance, so compliance is a very, very vast subject. It starts from the time we start interacting with the patient for the first time. So when we, so in the system, in our HMIS system, what we have done, we have started taking a lot of things as a control measure from the ART perspective. And what we did at the time of registration itself of the patient, we have taken certain steps which actually stops us doing, wrong registration in terms of age, in terms of taking the treatment at the right age. So we have placed certain locks into HIMS, which actually help us in controlling and being compliant from the ART perspective. And also, like we also have placed a lot of other things. Like I have placed few examples, like we have also placed Aadhaar card number as a control for us, so that the same donor will not be registered again, right? So we can actually control by using all these techniques. If people are using and typing the right consent, Aadhaar number, they will not be able to make mistake of registering the same donor for the second time, which is law itself says, right? So this is what is about consent, and this basically this entire compliance starts from the registration till the discharge. A lot of steps are there, and we have to follow, and we actually follow in NOAA in a very, very meticulous way, right? So, and also just to, I mean, tell you like what is the further step we are taking to make it more electronically savvy and to avoid all the errors which can happen even after choosing the right bundle of case sheet, a right bundle of treatment booklet. So what we are trying to do here is basically we are taking help of the electronic media, and we are introducing the barcode system over the consent. So once the patient is registered into our HIMS portal, then registration detail will be printed along with a barcode, which will be a combination of the medical registration number of the patient and type of the treatment. And on each and every page of that consent booklet, we will have this barcode. So this barcode will be printed, and here you can see the name of the patient and all the demographic detail of the patient we are printing over the consent from the system itself. So this helps us in two ways. One, this is going to reduce the work of the clinician and work of the teammates basically at the clinic. And secondly, we are going to also ensure that the right bundle of treatment set is being used for the right set of the patient. And the same consent, after taking the printout, we will take the signature of all the stakeholders, starting from the customer care executive, starting from the patient spouse, then clinician, and then the counselor who has counseled about the pros and cons of the treatment for which he or she is going for. And then we are supposed to upload this again. So this is helping us in two ways. One, we are printing the right set of paper for the right person. And then when after signature, when we are uploading these papers into the medics, this will go and sit into the right patient by reading these barcodes. So this will help us in also ensuring that this patient is being taken for the treatment, and the right consent is being taken and uploaded into the digital platform. So this will give us a complete hygienic medical record system, which will help us in preventing us as a clinic, whatever right practices we are doing it. In this way, we are going to document the right documents in the system for the same person. So this is what is basically about the compliances. And as far as the audit is concerned, Dr. Hitesh Bhatt and team, they are well-known figure in the field of medical legal audit, and they are the people who are doing audit for us. So we have technically two types of audit. One, we are doing physically audit with the help of Dr. Hitesh Bhatt and Dr. Geetendra Sharma. And here they basically, when they do audit of the center physically, they technically focus especially for these four verticals. One, statutory audit, which is the legal requirement. Then they focus on all the logbooks and log sheets, which is being maintained at the center from the team. Then third one is medical record file, which is going to be audited by them, and then they, gives us remark to to address all the non-conformances. And then embryology. So if we will say that in this entire IVF world, there are three main major pillars. One is clinical, second one is embryology, and third one is operations or administration, you can say. So clinical thing is taken care by Dr. Sonia ma'am to help the clinician how to do, what protocols should be used, and all these things. As far as the embryology is concerned, Dr. Sujata and team takes care of the entire embryology administration, starting from operations to embryological practices and everything. And as far as the operations of clinic is concerned, is basically taken care by the Mr. Vishwanath Ganguly, who is CEO, and we take care of the entire compliance at the center level. So this is what we are doing physically. And same thing we are also doing in a virtual format. In virtual format, we are again focusing on the very same thing, and we are keeping all these documents as a record for audit, which helps the team to understand where they are going wrong and which they can improve in future. Because any audit, the purpose of the audit is basically to improve day by day and to reach up to the place where we can be a teacher, right? So this is what basically is all about compliance and medical record audit. Thank you so much, ma'am.
Thank you, Nidhi. Thank you for
Thanks.
explaining it very elaborately and very clearly as to what is happening. This is very important for all of us doctors to know, because, you know, as doctors, Dr. Hitesh knows that we are very, very casual, or maybe, you know, sometimes we don't even know what is right and what is wrong. And therefore, this has to be really drilled into our heads that we have to do it the correct way. So that is very important. And since IVF is now full of IVF centers, and why should we call ourselves different? How should we call ourselves different? And what makes us different is what we have been trying to explain to you through this webinar. And I do hope that we have many questions after this. We have such great girls over here who are doing such good work, and also our experts, the embryology expert and the medical legal expert, who can answer all your questions, whatever is coming to your mind. So please, I do hope you have some questions here in the chat box. We will take them in a little while. So why should you choose us? We are using the latest technology. We have individualized and personalized treatment. We are very, very ethical, as you can see. We are so transparent. We have explained absolutely everything that we are doing in our centers. And there is 100% compliance with the law, both in all the acts that are presently present in the country, ART, Surrogacy, PNDT acts, and also the MTP Act. We are following everything. And so therefore, it is actually a very, we feel pride in this, that we are following everything correctly. We have uncompromising ethics. We treat our patient as the first person in every clinic that we have, and we are always striving for excellence. We are wanting that we should improve day by day. We are very ethical. We want that the patient should have their own genetic child. So 90% of the cycles in our clinics are now self cycles, only 10% are donor cycles. And that is something we are very proud of. You are a partner in our decision, because you are the ones who are also sharing your patients with us. So therefore, in order to make this act compliant, we have done all this even before. So this has been our practice even before the act. For us, there has been very little change after the ART Act came in, because we were already doing all this, and yet we just didn't have to step up anything. So remember, we are what we are. We are very honest and we are very transparent. Our mantra is always patients are first. Our team of specialists, embryologists, counselors, nurses are all with you throughout their fertility journey, your patient's journey, and we share complete information with our patients and the referring doctors to help them make an informed decision, and to help us also to know whether we gave them the right treatment or not. The well-being and needs of our patients are at the core of whatever we do on a day-to-day basis in our organization, and we are continuously working to give you a good partnership experience, and basically prove that in the medical community that we are really, really what we are saying we are. So we strive for excellence. We are continuously striving to improve our benchmarks and standards in clinical care, science and technology. We leverage teams, individuals, and best practices across the country to deliver superior outcomes more effectively. We are very proud of our outcomes, and we are very proud of the way we are practicing them. So with all this, we invite you to partner with us to share experiences, learn from each other, and forge ahead towards our common goal of ensuring the delight of parenthood to all our patients, whether they are yours or ours, completely shared by all of us. So do have confidence in all these girls who are sitting here today. They are the pillars of Nova. And so all of us together are inviting you to take this experience forward, and to have much more hands with us to join us and take this whole journey forward. Thank you very much, all of you, for being with us today. And I'm going to stop sharing my slides and take questions from all of you who are here today. ये मेरी तो slide को आज क्या हो गया? Okay.
I would like to add here, madam, apart
Yes,
from
please.
100 centers of the Nova, I am auditing 150 more hospitals, but Nova is one of the few hospitals where every law is followed, because we are following it up. I know that, and we are among the top ethical clinics in India.
Thank you. That deserves a clap for all of us. I think, thank you, Dr. Vitesh. That is the best thing that we've heard today. Thank you so much for having that confidence in us, all of us.